I'm Dr. Courtney Ray. I completed a four-year degree at the UC Davis in Davis, California in biochemistry. From there, I graduated from Tulane Medical School in New Orleans. I stayed on in New Orleans for another year and did an internship in medicine for Alton Ochsner Foundation Hospital. And then I went to the University of Columbia in Missouri to do my eye training. I was there for 3 years and stayed on an additional year to do a fellowship in cornea and external eye disease. From there, I did my first job in the Panhandle of Florida. I was in the Panhandle of Florida for about 10 years. I worked for a group called Panhandle Vision. And after 10 years, I decided I would go back home, and that's in California. I stayed in California for another 10 years, working for Coastal Eye Associates in the Monterey Bay area, and decided that really did miss the Gulf Coast, and we decided to move back here. And I've joined Southern Eye Group. Well, there wasn't anyone in particular. I had had several health issues when I was a child, and so I had built a rapport with my physicians, and that probably put the seed of the idea of becoming a doctor at a young age. It was really doing the undergraduate work in physics and doing the optics section of physics that intrigued me. And as time went on, the eye became more and more interesting to me. If you ask anybody which sense they would least want to lose, it would more than likely be eyesight. And ophthalmology is the discipline that is dedicated to the preservation and enhancement of eyesight. So I couldn't think of a more gratifying discipline to pursue, and I am humbled and honored that people would entrust their eyesight to me. Trust is the most important aspect of the doctor-patient relationship. Look, if you can't convince the patient that your motives are truly for their best interest, then you can't actually build that trust to follow the advice that you've spent years and years to learn how to deal with a lot of these conditions that they have. And if they don't trust your decision-making process, then they're not going to be as likely to follow your instructions, and therefore they would not benefit from all those years of your study, and they would not benefit from a speedy recovery. Although I did a fellowship in cornea and external eye disease, I've never really practiced solely as a cornea specialist. Mainly, I'm a comprehensive ophthalmologist, have done lots of cataract surgeries. I do pterygium surgery as well, have done a lot of those in the central coast of California. We use an amniotic membrane and tissue glue rather than sutures in that, and it seems to be very tolerable. So that's probably an update in that surgery, where the recurrence rate has dropped very significantly with the newer techniques. I do a canaloplasty surgery for glaucoma, which not a lot of practitioners are yet doing. There is a steep learning curve because there is a lot of delicate dissection involved, but the procedure does have a very good success rate. Well, I'll do a trabeculectomy as well for glaucoma. I do minor eyelid procedures, refractive surgery. I guess that about rounds up what I do surgically. In Southern Eye Group, I've been pleased to join a group of doctors who are committed to giving the best possible care to their patients, and a staff that is completely and enthusiastically devoted to promoting the goals of their doctors, their patients, and the group in general. With all this professional excellence and with the backdrop of the beautiful Gulf Coast, how could I want anything else?